Hello and welcome to Guardian Talks on Guardian TV. My name is Fatima Rachel. Across Nigerians, shelves and supermarkets are packed with dietary supplements such as pills, powders, and herbal teas. This supplement promises vitality, skin suppleness, and even weight loss. However, beyond these labels, a quiet yet dangerous health crisis is looming. Kidney damages, birth defects, and sending some to their early graves. Helping us to unpack this segment is a certified nutritionist, Fiyinfoluwa Odukoya, who will be shedding his view on the misuse of dietary supplements. Thanks for joining this conversation.
Thank you very much.
Supplements are everywhere, from the supermarkets to the gym, what have you. Even on Instagram, on social media, there are different adverts promoting supplements to people. Now the question is this: what is facilitating this craze? Is it that people are really concerned about their well-being, or they're just trying to fit into a model?
Okay, so thank you very much, Rachel, for that question. There are two things that you've highlighted, and there are two things I'm going to talk about. The first one is the genuine need. So there is the genuine need for supplements, right? And we have people that need them. However, there is also the societal pressure. So there are people with real deficiencies that actually need these supplements. So we are saying that for them, they need the supplement. And there are people that are taking these supplements not because they have any medical condition, not because there is an increased demand as a result of pregnancy, but there is the pressure to look in a certain way. You want to say, oh, flat tummy, big hips, light skin, so many mentalities. So there is the genuine need, and there is the people that are just taking them for so many reasons. And then another thing is we see that there are now aggressive marketing. You look left, you look right, you are seeing one same product being advertised on different social media platforms. In your subconscious, it is going to register in your subconscious. One day you want to try this product, because why is it everywhere? I open Snapchat, I'm seeing it. I open Instagram, I'm seeing it. I open Twitter, I'm seeing it. I open YouTube, I'm seeing it everywhere. In your subconscious, it is going to register, and you definitely want to buy it. And then there is the celebrity endorsement also. So there are so many factors that affect it. However, there is the genuine need, and there is all of this. People wanting to look in certain way, or the aggressive marketing that is pushing it into the market. And in your subconscious, it just registers, and people definitely buy.
All right.
And the unfortunate part is that this second group of people are the ones that use it without any medical guidance.
All right. Thank you very much for that. All right. So moving on to the next question. We've had cases of pregnant women suffering from miscarriage after taking some maybe multivitamins, and then we've also heard about cases of elderly ones who developed kidney damages later on in life due to long use of immunity boosters. So the question is this: when does taking supplements, it crosses the line of misuse or overuse?
Okay, so there are a lot of cases of people taking supplements or overdosing supplements in this part of the world. However, we have a data issue. And what do I mean by that? Most cases are underreported. So most people do not realize that a lot of their issue is being linked to supplement abuse or supplement misuse, as the case may be. And most of the time, we're only just treating symptoms without having to look out for the root cause. So people most of the time would not connect, taking supplements that make me suffer from this miscarriage in the long run as a result of excess dose or complications from it or misuse. And people would think that, because it is vitamin, because it is herbal, they never would want to mention it to their healthcare professional that they are on it. So most of the time, they wouldn't even be able to link it to maybe, this is it, because they would never tell you. I've seen cases where I have consulted clients, and then I just start asking them, so what do you take? What do you take for your blood sugar and all of that? They would never tell you that this is the particular thing that they take until you start listing that, you used to drink pawpaw tea, you say yes. You used to drink this one, pawpaw leaf. You used to boil this leaf. Then they start telling you one by one certain things that you take. But they do not realize that those ones are also this thing. But because it is herbal and it's a supplement, they feel like, you're not taking it. You are not taking it. You just feel like it's part of food. All right.
Thank you for that insightful conversation. Okay, so the next question is this. I mean, people usually fall under this belief that once it is said to be safe or natural, I mean, they believe that, oh, they can use it as much as they want because it is certified as natural. So the question is this. I mean, why should people prevent themselves from being addicted to these so-called natural remedies or supplements?
Okay, thank you very much. Bobonishe is natural. Poisonous mushroom is natural, but does that make them healthy? No. That particular mindset of saying natural is safe is a very, very terrible and a risky mentality. So saying things like is safe equivalent to natural, it is a very scary mentality. We have seen cases where herbal teas, where buboniche, where all these combo drinks and juices and whatever it is affects the liver and raises the liver enzymes, right? So you need to be very sure, or you need to understand, even natural slimming tea, in quotes, as they like to say, it is natural, right? But then it will cause things like heart palpitations, things like drinking bitter leaf juice. So people say, oh, they are drinking bitter leaf juice because of this thing. It can affect pregnancy and all of that. So all of this. So the thing that it is, the fact that it is gotten from the earth doesn't exactly make it safe. The fact that it is gotten from the earth doesn't make it safe. What matters most is the dosage and the interaction. Nutrient to nutrient interaction, nutrient to drug interaction, and so many other things. So these are things that matter beyond just a it is safe.
All right. To the next question. So we have a lot of celebrities endorsing all the supplements. You see some celebrities like a popular female celebrity, Mercy Johnson, endorsing about his slimming product. I mean, what are the hidden dangers of using supplements for beauty purposes only?
Okay, so most of all of these medications that are used for beauty purpose are undeclared medications. That is one. They will never tell you the things that it contains. That is one. Two, it is unregulated. Three, you see things like steroids. Four, heavy metals. Even glutathione in high dosage can affect the liver. And some of all of these, they are hip boosters, and the rest contains things that affect your hormone in the long run, and then these things will disrupt your period, it will disrupt your menstrual cycle, and you will not be able to link it to know that it is that drink that you are drinking, or also would increase your risk of developing certain kind of cancers. So having to chase short-term beauty fixes can affect your health in the long run and put you at risk of so many health conditions. So are you going to pick looking like whatever you feel like societal beauty standard is for a very long time, and you are dying inside, rotting inside literally, or you're going to just be healthy and live the right state? So you want to pick either trading short-term beauty for long-term health problems, or you want to be healthy and you want to just be fine. It depends on
you. All right. As a certified nutritionist, can you tell us the right time and the right duration, and also the right proportion, to always follow when making use of this supplement?
Okay, so dosage as well as duration matters. And what is dosage? Dosage is the amount that you are consuming, the amount that you are taking. And what is duration? Duration is for how long you are going to take it. So it matters a lot in the body, because how your body processes all of these things matters. Your body can only process certain amount and it will not process it. So let's look at fat soluble vitamins like vitamin A, vitamin E, vitamin D, and vitamin K. These are supplements that people would most likely abuse, right? And a lot of them, because they are fat soluble, they can accumulate in the liver and they cause toxicity over time. Unfortunately, a lot of people abuse vitamins and supplements, but they do not know that they are at risk of overdose. People even abuse things like vitamin C in the long run. I think the only good thing about vitamin C, or the only narrow escape that people have, is that it is water soluble. So when your body takes the amount it needs, the rest is going into your urine. Yes, that's the only way. Unfortunately, it isn't the same thing for fat soluble vitamins. So this can absorb in your liver in the long run, causing toxicity. Things like minerals like iron, when you take them in overdose, can also affect you. And then continuous dosage or continuous high dosage without break or going for a test can also put you at risk of different health complications. So you want to try as much as possible to do tests, or you want to go for your blood test, your blood work before, if you are seeing symptoms of deficiency or you feel like you are deficient in certain nutrients. Don't just go and take the supplements. Go for tests. Go to the lab, go to a diagnostic center, better still go to a wellness center with actual medical doctors. Or you want to ensure that you are going to the hospital, get your blood work done, get your lab test done, let the results be out, let the doctor, the dietitian, let them review your result, let the nutritionist see your result, let them now tell you, okay, we want to use food to manage it first. If food, or if it's very low, we want to put you on certain medications for a certain duration of time, maybe put you on a particular amount of vitamin D for about 1 month, 2 months, 3 months, and then after that you actually come back for another repeat test and see, oh, is your numbers better? Okay, your numbers is better. We are taking you from 10,000 IU of vitamin D to 5,000 because now your numbers are already better. So things like that, so cases like that.
Thank you so much for that. So you made mention of some deficiencies to watch out for, to know that, oh, maybe you are already overdosing. Can you elaborate more on these deficiencies?
Okay, so I said in order to know that you need in a particular vitamin, there are certain cases that you might see. So for certain people, it can be fatigue, it can be lack of concentration, and there are so many things. I mean, the body system is pretty different, so you can see different kind of. So there might be so many kind of things. It might be tingling sensation in your hand. There are so many things that would show forth. It can be your appetite. There are so many things. It could be loss of sleep. It could be a consistent headache. It could be you forgetting things easily. So some of these things, it could even be weakness and all of the rest. So there are so many things that we would see, and then we will not say, oh, come and do this test, come and do that test. And then when the test has been done, we now say, oh, the result, and they will now put you on maybe certain supplement, or we say it well. It's more of certain things, and they will now explain to you that you should eat certain things together with certain things to help absorb that particular nutrient better. Yes.
Thank you so much. Second to the last question, how we call this segment, how we call it to a close. So we have a lot of sellers online, advertising these supplements, and most of them, they have minimal professional training. So the thing is, how do an average Nigeria identify a credible medical advice from marketing jamboree?
Okay, that's great. So first off, an actual healthcare professional will not speak from the place of emotions. And what do I mean by that? I would not let my emotions cloud me, and I will always speak based on research. So bring out research, let's do cross-analysis, let's do cross-sectional analysis, bring out your facts, I will bring out facts. I'm not saying, oh, I said this, I saw this, I see that, I see those. We're bringing out research, we're bringing out results, we're bringing out what science, scientific knowledge. This is scientific knowledge, that is one. And that is one way that you can know an actual professional. Another one would be every healthcare professional, actual healthcare professional, is always ready to flex their result and always ready to flex their certification and their qualification. I mean, I worked for it earnestly. I worked for it days and nights. So I want to flex my result, my certifications. I want to flex my degree and let you know that this is it. So most actual healthcare professionals will really put everything. So whatever it is, whether they are a fellow of this association, a member of this association, all of the rest, they will always put it in their bio. Whatever professional association that they belong to, you see a lot of them put it there. That is 2. 3, there is a way you would interact with them and they would know. So one of the red flags is that you want to be sure that they're actually qualified. Like you could tell people and say, I mean, in an argument, I have had times where I'm arguing with non-professionals, and they say, oh, what? And I'm like, oh, I studied this for 5 years, 4 years, and these are the things and this is my license, and this and this and this and this and this, and you're like, oh, and then they will definitely will not respond to you again. They are most likely going to block you. So you already know that is that. And I've seen patients ask me, oh, which school did you finish from? Where did you finish from? Where have you worked before? Just because they want to be sure that, okay, this person actually know what they are doing. So actual healthcare professionals are never scared when you ask them where they trained. They would answer you and they will bring evidence. That is one. Two, you never see them marketing a cure or marketing something that will guarantee cure. So you will never see an actual healthcare professional saying that, oh, I would cure your diabetes totally. Rather, you see them say things like, I'll put you into diabetes remission. They will never tell you that, oh, if you drink this herbal concoction, it will cure your diabetes. If you drink this one, the fatty liver will dissolve. If you do this thing, the fat will go inside. And like, you would never hear things from them. You would never take things from them like that. And they would never promote certain products. And people that are unqualified will always sell things without ingredient list or unclear labeling. Because we as healthcare professionals know the impact of unclear labeling and no ingredient list. Because we're taught about consumer education and all those consumer standards, and we want people to be empowered and educated to know what they are putting into their body system. So healthcare professionals will let you know that. But people that are not healthcare professionals will not tell you that. They would never tell you that. And then they would also never push a one-size-fits-all. You would never see an actual professional put a one-size-fits-all. I tell you that, oh, there are 1,001 ways to manage diabetes, there are 1,001 ways to manage PCOS. You can't manage one person the same way, because no two persons have the same body system. No two persons function the same way.
All right. Thank you so much, Mr. Fiyinfoluwa Odukoya. And the last question is this: if there's one golden rule you want to give to Nigerians regarding their use of dietary supplements, what would it be?
Okay, so there are three things I would say. So I tell my clients something, and this is what I tell them: CFN. That is the golden rule for me. One, test before you take. So you want to ensure that you are going for tests. You want to ensure that lab works are being done. You want to know where you are coming from to where you are going to. That is one. Two, ensure to follow the right dosage and stop it when you no longer need it. So it means follow. So test for T, F for follow, and M should be never replace a balanced diet or a medical treatment with supplement. Very important.
All right. Thank you so much for this insightful conversation. I mean, I've learned a lot, and I'm very sure our audience out there also, they've grabbed one or two things from this conversation. Thank you so much for your time.
Thank you so much, Rachel.
Enjoy the rest of your day.
And you too. Have a great day. Bye.
Bye. Once again, thank you, Fiyinfoluwa Odukoya, for sharing this wonderful insight with us. The bottom line of this conversation is this: supplements is not just candy. If used properly, can promote health and general wellness, and if used wrongly, could lead to some health complications. Till I come your way next time, I'm Fatima Rachel. Bye for now.